What's up, guys? I hope you guys are fine. And today we'll be talking about circulation adjustment at birth. Okay. Having spoken about the fetal circulation, how is the circulatory system in a fetus readjusted at birth? That's what we'll be looking at today. So let's proceed, guys. We said that. Okay. Let's just trying to see. This is fetus. This is the circulation. You see the placenta. I could see here that the placenta has been lesioned out. Okay, so let's go back and see what the lecture note got for us. Now we see that fetal circulation completely changes after the first gaps of air. The events that characterize this switch, over on the first gaps include what? Loss of what? 350 mils of blood through the placenta at birth, with a high consequent high systemic peripheral vascular resistance at birth, which creates what? High aortic pressure and left heart pressure. Okay, there's also reduction of pulmonary vascular resistance sevenfold due to the expansion of the lungs with the first gaps of air. Okay, aeration of the lungs results in pulmonary vasodilation. The high left heart and the low right heart pressure reverses blood flow from the right heart to the left heart through the foramen ovale. The septum primum was flaps over the foramen and closes it. This functionally completes the separation of the heart into what? Two pumps. That's the right and the left sides of the adult heart. Okay. This closure becomes what? Permanent in the next few months to the early years. All right. This is the fetal circulation, and basically what we are talking about is what? This foramen ovale. This is a foramen ovale that we spoke about. The septum premium shorts it. Okay. Let's go back and continue. I will say that the foramen ovale may persist for years in few number of individuals to become what? The persistent foramen ovale. The closed foramen ovale becomes what? The fossa ovalis. And equally, blood flow through the ductus arteriosus. Is reversed, okay, with oxygenated blood now flowing backward from the aorta into the pulmonary aorta artery. Okay, the ductus arteriosus muscle constrict markedly in response to this high what? Oxygen saturation in the blood passing through it few hours after birth. This constriction or this restrict all blood flow through the ductus arteriosus about the 8th day post delivery. Okay, that's the functional closure of the ductus arteriosus. Okay, this is the ductus arteriosus up here. Okay, I will say that uh, equally blood flow through the ductus arteriosus is reversed with oxygenated blood now flowing backward from the aorta into the pulmonary artery. Okay, so now within the first 4 months after birth, the constricted vessel fibrose, okay, resulting in what? Permanent occlusion. All right, and the ductus arteriosus is what? Replaced by connective tissue and becomes what? The ligamentum arteriosum. And prostaglandin antagonists hasten the occlusion of the ductus arteriosus, and failure of the ductus arteriosus could result in what? Serious birth defect characterized by marked elevation in pulmonary pressure. Okay, now because blood flow from the left ventricle to the aorta through the ductus arteriosus to the pulmonary arteries, if uncorrected, it can lead to irreversible degenerative changes in the heart and the lungs. Okay, now with occlusion of the umbilical cord, hence the umbilical vein, the ductus venosus constricts in the next 3 hours after birth. Blood returning through the portal vein increases with pressure rising from 6 millimeter mercury to 10 millimeter mercury. This forces the blood through the liver, thereby opening the liver channels. Remnants of the umbilical vein becomes the round ligament of the liver, and the ductus venosus becomes what? The ligamentum venosus. Okay. So this is the circulation. This is like a summary of everything that we are talking about. Before birth, you see the ductus arteriosus here. All right. We see immediately after birth, you see the ductus arteriosus constrict, allowing all blood leaving the right ventricle to travel to the lungs via the pulmonary arteries. Okay. Next, we see the foramen ovale closes, leaving a small depression called what? The fossa ovalis. Okay. This isolates deoxygenated blood from the oxygenated blood. Okay. And there's another illustration down here. Okay, that you could pause this video to look out for yourself. Now, let's talk about the respiration onset at birth. Now, following clamping of the umbilical cord, the baby loses its source of nutrients and, most importantly, oxygen. You know, the baby receives oxygen from the mother. Now, it gaps from asphyxiation and exposure to the colder external environment. Okay, stimulating sensory endings on the skin. This response is obtainable in neonates not under anesthesia. Generally, anesthesia will depress the respiratory center and hence the onset of respiration. Okay. Now, after the first gaps of air, a respiratory rhythm gradually becomes restored in the first minutes, where there is what? Delay in onset of breathing and hypercapnia. Hypercapnia that ensures becomes what? A further stimulus towards the onset of respiration. Okay. Now, circulation in fetus and newborn. Um, this is fetus. This is a newborn. Okay, and so on and so forth. Okay. So these are some points right here. You could pause this image to study for yourself. Ductus venosus shunts that bypass the liver. Foramen ovale opens in the arterial septa to bypass the pulmonary circulation. Ductus arteriosus transfer blood from the right ventricle to the aorta, and so on and so forth. Okay, so all this will shut up. Okay, giving the liver a new, giving the heart a new circulatory system. Now, the physiology is thought to arise from the following. The first gaps of air produce a pressure up to minus 60 millimeter mercury in the intrapleural space. This force open the lungs at onset of breathing, and at the peak of this respiration, and from the intrapleural pressure of 30 millimeter mercury, about 40 mils of air enter the lungs. Now, deflation of the lungs about after the primary inspiration requires somewhat high pressure of about 30 millimeter mercury. Sorry, this was minus 30 millimeter mercury. This is due to the fluid in the alveolar and the airways. The abdominal muscles are of great use during this onset of respiration. Now, however, subsequent respiratory efforts become easier as the lungs open up and the fluids are gradually removed. Surfactant also play a crucial role, and failure of surfactant maturation results in what? Hyaline membrane disease. Okay, so that's it, guys, for uh, circulation adjustment of birth. Okay, and onset of fetal respiration. Okay, so I'll see you guys in the next tutorial, and bye for now.